The Sunshine Supplement. A comprehensive look at vitamin D supplementation. Vitamin D, often dubbed the sunshine vitamin, is a fat-soluble nutrient that plays a crucial role in numerous bodily functions. While our bodies can synthesize vitamin D from direct sunlight exposure, many individuals worldwide experience deficiency due to various factors, including limited sun exposure, darker skin pigmentation, dietary restrictions, and certain medical conditions. In such cases, vitamin D supplementation becomes a vital tool in maintaining optimal health. This comprehensive article will delve into the intricacies of vitamin D supplementation, exploring its benefits, who might need it, different forms, dosage considerations, potential risks, and how to use it safely and effectively. The indispensable roles of vitamin D. Before exploring supplementation, it's essential to understand why vitamin D is so critical for our well-being. Its primary and most well-known role is in calcium and phosphate absorption. Vitamin D facilitates the absorption of calcium and phosphate from the gut, which are essential for building and maintaining strong bones and teeth. Without sufficient vitamin D, the body struggles to absorb these minerals, leading to weakened bones. 4. Bone health. By regulating calcium and phosphate levels, vitamin D is crucial in preventing bone disorders like rickets in children, soft and weakened bones, and osteomalacia in adults, bone pain and muscle weakness. 5. It also plays a significant role in preventing and managing osteoporosis, a condition characterized by brittle bones and increased fracture risk. 6. Beyond bone health, research suggests vitamin D may also be involved in immune function. Vitamin D receptors are present on immune cells, and the vitamin plays a role in modulating immune responses. 7. Adequate levels may help the body fight off infections and reduce the risk of autoimmune diseases. 8. Muscle function. Vitamin D contributes to muscle strength and function. 9. Deficiency can lead to muscle weakness and an increased risk of falls, 10 particularly in older adults. 1112. Cell growth and differentiation. Vitamin D may play a role in regulating cell growth and preventing the development of cancerous cells, although more research is needed in this area. 13. Mood regulation. Some studies have linked low vitamin D levels to an increased risk of depression and other mood disorders, although the exact relationship is still being investigated. 14. Cardiovascular health. Research suggests a potential link between vitamin D deficiency and an increased risk of heart disease and high blood pressure, but further studies are required to confirm this connection. 15. Blood sugar control. Some evidence indicates that vitamin D may play a role in insulin sensitivity and blood sugar regulation, potentially impacting the risk of type 2 diabetes. 16. Who might need vitamin D supplementation? Given the widespread prevalence of vitamin D deficiency, many individuals could potentially benefit from supplementation. However, it's crucial to identify those at higher risk. Limited sun exposure. Individuals who spend most of their time indoors, live in regions with limited sunlight, especially during winter months, wear clothing that covers most of their skin, or use sunscreen consistently may not produce enough vitamin D from sun exposure. 17. This is particularly relevant for individuals living in locations like molten, Punjab, Pakistan, where while sunshine is abundant for part of the year, cultural practices or lifestyle might limit direct exposure. Darker skin pigmentation. Melanin, the pigment responsible for skin color, reduces the skin's ability to produce vitamin D18 from sunlight. 19 individuals with darker 20 skin require more sun exposure to synthesize adequate amounts. 21. Older adults. As we age, our skin's ability to produce vitamin D decreases, and the kidneys become less efficient at converting vitamin D into its active form. 2,223 older adults also tend to spend more time indoors. 24. Infants exclusively breastfed. Breast milk generally contains low levels of vitamin D. The American Academy of Pediatrics recommends vitamin D supplementation for all exclusively breastfed infants. Individuals with malabsorption issues. Certain medical conditions, such as Crohn's disease, celiac disease, and cystic fibrosis, can impair the absorption of 25 fat-soluble vitamins, 26 including vitamin D. 27. Obesity. Vitamin D is stored in fat tissue, making it less bioavailable for obese individuals. They often require higher doses to achieve adequate blood levels. 28. Gastric bypass surgery. This type of surgery can affect nutrient absorption, including vitamin D. 29. Certain medications. Some medications, such as anticonvulsants, glucocorticoids, and certain HIV medications, can interfere with vitamin D metabolism. 30. Individuals with kidney or liver disease. These organs play crucial roles in converting vitamin D into its active form. Impaired function can lead to deficiency. Forms of vitamin D supplements. Vitamin D supplements are available in two main forms. Vitamin D2, ergocalciferol. This form is typically derived from yeast or fungi. 31. It was the original form of vitamin D available in supplements. Vitamin D3, cholecalciferol. This form is the same as the vitamin D produced by our skin in response to sunlight and is also found in animal sources like fatty fish and fish liver oils. 32 studies generally suggest that vitamin D3 is more effective at raising and maintaining blood levels of vitamin D compared to D2.33. Both forms are available in various formulations, including tablets, capsules, liquids, and chewables. 34. The best form may depend on individual preferences and any underlying health conditions. Dosage considerations. Finding the right balance. The appropriate dosage of vitamin D supplementation varies depending on an individual's age, baseline vitamin D levels, health status, and risk factors for deficiency. 35 general recommendations include: infants, 0 to 12 months, 400 international units, IU, daily. 36. Children and adolescents, 1 to 18 years, 600 IU daily. 37. Adults, 19 to 70 years, 600 IU daily. Adults over 70 years, 800 IU daily. 38. Pregnant and breastfeeding women, 600 IU daily. Some guidelines suggest higher doses may be beneficial under medical supervision. However, these are general guidelines. For individuals with diagnosed vitamin D deficiency, healthcare professionals may recommend higher doses initially, e.g., 2,000 to 6,000 IU daily or even higher in some cases, to rapidly replenish levels, followed by a maintenance dose. Blood tests to measure 25-hydroxyvitamin D, 25-OD, levels are the most accurate way to determine an individual's vitamin D status and guide supplementation. 39. The target range for optimal health is generally considered to be between 30 and 50 nanograms per milliliter, 75 to 125 nmol, L. Potential risks and side effects of supplementation. While vitamin D supplementation is generally safe when taken at recommended doses, excessive intake can lead to vitamin D toxicity, hypervitaminosis D.
40. This condition is usually caused by taking very high doses of supplements over an extended period and is not typically a result of sun exposure or dietary intake alone.
Symptoms of vitamin D toxicity can include nausea and vomiting, poor appetite, constipation. 41. Increased thirst and urination. 42. Weakness, confusion, bone pain, kidney problems, including kidney stones. 43. Irregular heartbeat, in severe cases. 44. The tolerable upper intake level, UL, for vitamin D is 4,000 IU per day for adults.
However, some healthcare professionals may prescribe higher doses for short periods to treat deficiency under close monitoring.
It is crucial not to exceed the recommended or prescribed dose without medical advice. Safe and effective vitamin D supplementation.
To ensure safe and effective vitamin D supplementation,
consult your healthcare provider before starting any supplementation, especially at doses higher than the general recommendations. Discuss it with your doctor. They can assess your individual needs, check your vitamin D levels, and recommend an appropriate dosage. Choose the right form. Vitamin D3 is generally preferred over D2 due to its better absorption and ability to raise blood levels. 45. Follow dosage instructions carefully. Adhere to the dosage recommended by your doctor or the instructions on the supplement label. Do not exceed the recommended dose. Take with food. Vitamin D is a fat-soluble vitamin, so taking it with a meal containing fat can enhance its absorption. 46. Be aware of other sources. If you are taking a multivitamin or other supplements that contain vitamin D, factor that into your total daily intake to avoid exceeding the upper limit. Monitor for symptoms. Be aware of the symptoms of vitamin D toxicity and discontinue supplementation and consult your doctor if you experience any of these. Regular monitoring. If on high doses, if your doctor prescribes high doses of vitamin D, they will likely monitor your blood levels of vitamin D and calcium regularly to ensure safety and efficacy. Conclusion. Harnessing the power of vitamin D supplementation wisely. Vitamin D supplementation can be a valuable tool in addressing deficiency and supporting overall health, particularly for individuals with limited sun exposure or increased needs. 47. Understanding the benefits of vitamin D, identifying risk factors for deficiency, choosing the appropriate form and dosage, and being mindful of potential risks are crucial for safe and effective use. Always prioritize consulting with a healthcare professional to determine your individual needs and ensure that supplementation is a beneficial and safe addition to your health regimen in the context of your specific circumstances in the world.